This video gives you an overview of home hemodialysis. It is not intended to teach you how to do home hemodialysis, but rather provide you with a picture of what home hemodialysis involves. You and a caregiver will be trained on home hemodialysis procedures by the home hemodialysis team in your center. Claire does home hemodialysis at night for 8 hours, 5 to 6 nights per week. There are many ways to do home hemodialysis. At night for 6 to 8 hours, 5 or 6 nights per week, or during the day for 3 to 4 hours, 5 or 6 days per week, or 4 hours, 3 days per week, such as Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, or Sunday. How you choose to do home hemodialysis depends on your life, your activities, and your health status. This video shows some of the procedures that Claire does. Some of these procedures may take longer than presented. The hemodialysis machine may look different than the one at your center, as there are several home hemodialysis machines available. However, the basics of home hemodialysis are very similar. The procedures may vary in your home hemodialysis unit.
These are all my supplies I need for 1 week. I usually fill it up. I have my syringe and my gauze, another drawer of the smaller syringes, all my dialyzers or artificial kidneys, my blood lines and the drain bags, and then my saline. So I usually stock that up weekly, and that'll be enough for 1 week. So this is my reverse osmosis machine. I start it on 10 minutes before I actually start setting up the treatment. We got to let it run for 10 minutes. Then I come over to my machine. There's my acid concentrate, my bicarb concentrate, which is prescribed to you by your doctor, depending on what you need. It'll clean your blood. Once I'm done treatment, I clean everything, and then from my last treatment, I've already hung my IV bags, my dialyzer or my artificial kidney. I've put out my lines and my drain bag and my acid and my bicarb. I usually do it the night before, and then when I come, there's just a little less to start the treatment with. So then once the machine is on, I check my settings. So you just double check all of that before you confirm it. Now I have to let it run for 10 minutes, and during that time, I'll start to put my lines on. And this is your arterial line you start with. Oh, sorry, check the time. So I run for 10 minutes with it. This arterial line is the one that brings the blood from me to the machine. And then I'm a single needle user, so I use 2 pumps. If you were to use 2 needles, you would only have 1 pump on your machine, and your setup would be a little different than this. Not too much different, just only the 1 pump wouldn't be there. And this is my venous line, which will be returning my blood. And then this is the flow sheet. It's very similar to what they use in center, but it's just not, because I do 8-hour nightly treatments, I only record my start pressures and my finish pressure, end pressures in the morning. And of course, have to weigh ourselves. Great for the ego. Daily. So I do put your dry weight in, or what you weigh now and what your dry weight is. So what I would have to take off for this treatment is 0.8 of a kilo. I've only gained 0.8 since yesterday. Then I set up my needles. So this is what a single needle user looks like. Holds my lines while I sleep, so then they're not tossing and turning everywhere. I was given one when I started from the unit, and then I had to recreate because I wore it out. So it's been 10 minutes, then I'll have to test my RO water for hardness and for make sure there is chlorine, no chlorine, and not too much chlorine in my water. So we get the water hardness test strips. And it'll show on the side what color there should be. It should be a blue. Starts out as blue, so it shouldn't change. You can see it's stayed the same, so it's good. My water hardness is good. And then I also check for chlorine. Again, it should come back the same color as it goes in. And you got to do it for 30 seconds. And again, it's come back same as it went in. So it's good too. And if they were not good, you would have to not be able to do treatment. You would have to call your technician and get things figured out. So now I have to record daily that I've done those checks, and then some numbers like the conductivity, the temperature of the water, and then we can start. You start dialysis. So this is a fistula. It's all natural. It's versus a graft, I guess, where I've had a graft on my upper arm, which doesn't work anymore. I've had a fistula here, and we're going to try and recreate another fistula here. I've had a fistula in my thigh, and I've had 3 perm caths. I do my blood pressure on my leg because of the surgeries I've had on my arms. We want to reserve my arm. My surgeon doesn't want me using my arm because he wants to try and save it for another creation of a fistula. So I do mine on my lower leg, and I only do this one. Now I pull out my machine close to the bed. Hop up on the bed. There's my tourniquet, nice tourniquet they give you. Easy to use. I cannot use chlorhexidine, I'm allergic to it, so I use the iodine solution. I wasn't always allergic to the chlorhexidine either, it just after so many years of use, I think, is what. So I'm going to give my arm a good wipe. Okay. here's a needle. Turn it up, turn it over, kind of pull your skin back a little bit, and in it goes. Let the tourniquet off. Tape it down with the tape that's a little more flexible, and then check your lines to make sure that it works good before you tape it right down. Both lines seem to be running well. And anchor it with a little half tape. Give it a good anchor. And then one more tape. You can never have too much tape. And then you take your line off your machine. Red on red. Blue on blue. Give you a 2 ml bolus. Now I tape my connections because I sleep with my lines. I sleep during treatment. You don't want your lines separating. This just gives you a little peace of mind, I guess. And now I'll start treatment. Start. Use too much tape. But I can never have too much because then I can sleep better, right? So I just record my heparin, how much was in the initial bolus, and then just different things off the screen, my conductivity, my start time, my blood flow rate is 150 per, and then my pressure. So I'm done my treatment. Now I'll record the information that the machine has stored. So I'll go to my treatment history. And I'll record all the time I'm off, blood pump speed, got my towel. Take all my tapes off. And then I'll hit treatment end, stop the blood pump. Undo it a little bit and then tie it back up. Hook my line up to my machine so I can return my blood. Now I'm going to pull my needle. So when you're pulling your needle, put your line in between your thumb and your pointer finger. And I like to have my gauze already taped down, so it's just easier to, yeah, of course, a little easier to maneuver if it's taped already. Carefully peel your tapes back, holding your line so you're not pulling it out until you're ready. It's not going to work. Okay. And then you pull it a little bit, and then out she comes. You got to give it a fair amount of pressure, especially mine is quite, my fistula is getting old, so I need a lot of pressure on it. So now I'm done treatments. Hook up your connectors. There. Then you would dispose of these. This one goes in your toilet, and this one goes in your sink. And when you put your chemicals in, or your baths in the drain, you want to make sure and rinse them and flush your toilet really well. Otherwise, they can bother your plumbing. And you just give your machine a good disinfect. Even though it's just you using it, you still want to give it a good cleaning. You don't want to get dirty. And then once the vinegar rinse is done, you do a heat disinfect and you're done. Once a week, you have to bleach your machine. So you'd fill this up to the line, you hook it up to your machine, disinfects the machine. Daily, you do your regular maintenance of the machine. You clean it with the wipes that are supplied again. Preamp disinfecting wipes. You clean it all down once you've stripped it, and then you would do a acid rinse with vinegar. You hook it up to the machine, and then a heat disinfect. I took training. I was there 7 weeks. After 5 weeks, I had a pretty good take on it. And you got to remember, I've been doing dialysis 20 years. So, but the plumbing and the modifications had to be made to the home yet. So I still went for 2 more weeks there, which helped me be a lot more comfortable coming home, being in center with the nurses, practicing their needling and that. But even saying that, when still coming home, it's I can't explain. It's stressful, very stressful, but the benefits outweigh that stress by far. I have a normal life again. Well, somewhat normal. I have energy. I have my days. I don't have days leading up to treatment, having treatment, and then being bagged out for a day and a half, starting to feel good again, and then I have to go back. Whereas now, I sleep for 8 hours, and then I do what I have to do, and I get up and I go for a 5-kilometer walk, and I play with my grandbabies and go bike rides. Yeah, it's changed my life. Since I've been doing this, my health has improved. Other than my kidney failure, I could say I'm a pretty healthy person. And I think this has helped a lot. This has made a big difference in my life. I won't lie, it was very stressful. The first year, I don't think me and my husband slept. The benefits have outweighed that by, I would do it again. Even though I knew how stressful that first year was, I would do it all over again. I did have my husband come train with me for 4 weeks, and he did learn a lot. And he's my support person by far. He is an RN, but he's not a dialysis nurse, and he can help me if something is going wrong, he can help me. He doesn't set up the machine or he's not hands-on with the machine, but if I'm not feeling well, and he can help me figure out what's going on. I should mention that there's also, you always have this hanging on your dialysis machine. It's an emergency disconnect. Say your house catches on fire, you got everything in here you need, you just cut your lines, you clamp, cut, and go. But then also there's this, if the power goes out, step by step how you return your blood. It takes about 7 minutes to get all your blood back, and the machine alarms the whole time you're returning your blood. So you just have to be patient and not listen to the machine. So I always have these hanging here, just in case. I've used this, in the 6 years, I've used this once. And that was a storm, and the power went out, and just manually returned my blood.